Hello, I'm Dr. Michael Ches. I'm a pediatric epileptologist and neurologist in the Sacramento, California area, and I'm asked by the Lennox-Gastaut Foundation to talk to you today about Clobazam, also known as Onfi and other trade names such as Sympazam. Clobazam is a benzodiazepine, which is related to drugs that have been around a long time, such as Valium, Ativan, Klonopin. It is a little different in that those have a fourth ring of its compound nitrogen, and this is on the fifth ring. And so that is why it differs in some of its properties, such as sedation and tolerance compared to some of the other benzodiazepines. They all work on the GABA A receptor. It's been around over 30 years, initially developed for anxiety and then found to be an anti-seizure medicine. It's been around, initially developed in Australia and Europe, and has been in multiple countries around the world before coming to the USA as a drug for Lennox-Gastaut syndrome. It comes in liquid tablets and oral gel forms. It, like I said, binds at the GABA A receptor, and these are in various areas of the brain, and it works through modifying the chloride channels in the GABA receptor, which then can hyperpolarize or block overexcitement of the cell. And it works in a inhibitory fashion postsynaptically, and allows the nerve cells not to transmit excited messages to cause seizures. Now, it's been studied in a broad spectrum of LGS patients of multiple ages from childhood to adult age, and it was approved for FDA use in Lennox-Gastaut through one of the largest trials in history, using 238 Lennox-Gastaut patients. There are other large trials out there, but this is one of the largest. It significantly reduced the mean drop attacks and seizures in all the treatment groups studied. And in the higher dose, which was 60 milligrams a day versus 40 versus 20, there was a 68% reduction in tonic and atonic seizures. And there was a reduced over placebo even in the lowest group. And it's an excellent choice for drop attacks. And it was one of the most common medications used in Dravet syndrome and Lennox-Gastaut syndrome. And side effects can include sedation, drooling, sometimes worse irritability or behaviors. It can paradoxically cause insomnia, although in most people it makes them drowsy at higher doses. But it's not as sedating as lower doses as some of the older benzodiazepines. You need to monitor drug-drug interactions. It can interact with Epidiolex and be increased so that your side products, such as the main metabolite of clobazam, which lasts 30 days, is called desmethylclobazam. And that product increases up to 10-fold, and clobazam increases about 3-fold to 5-fold with use with Epidiolex or CBD products. So if you do have drugs that inhibit the CYP219 enzyme system in your liver that breaks these drugs down, you will have increased clobazam. So when you use those drugs together, it's something to keep in mind. Overall, clobazam levels can be checked, and it can be safely used clinically and monitored. And it's very safe on the liver and kidneys otherwise, as a general rule. And it's a product that's very effective if side effects can be tolerated. Thank you for letting me talk about clobazam today. I hope that it was useful information to make you feel more informed about how it's used in Lennox-Gastaut syndrome and other conditions such as Dravet syndrome.